almost every person living on this earth right now is going to have some type of back problem as they continue to grow older. Many of us have a lot more problems than others. It can come from accidents, obesity, overweight, poor posture, or sitting in the position that I am right now. Every person that drives, sits at a desk, sits in school, sits at home, watches TV, are all in the same position, the hip flexors. When the knee comes up like this towards the chest, these muscles deep inside, called the iliopsoas muscles, they shorten. And when they shorten, the entire back area has to compensate. The glutes, the back of the glutes, the thick muscles that we sit on, start to become weaker. They become inactive because of the over-contraction and tightening of our hip flexors. So I'm going to show you just a few things that you can do that's going to do amazing things for your back problem. And even if you don't have back pain, you still want to do what I'm about to show you because you'll prevent it. So are you ready? Let's get to it. And I wore this tight shirt for one reason, so you can see exactly what I'm doing so you can follow along to get those great results. Remember, every time we bring our knee up like this, these hip flexors have to contract and they're shortened. And when they contract, it makes the pelvis rotate forward. We call that anterior pelvic tilt. Now let's watch. If I bring my pelvic like this, rotating anterior, doing this is posterior. From the side, this is anterior, posterior, anterior, posterior. You can see my pelvic rock. Okay? So when it goes anterior like this, that's not good because it's shutting off our glutes and that's going to make the condition worse. So what we're going to do is that we are going to stretch the deep hip flexors, the lower erector muscles, the quadratus lumborum, which are the deep muscles in our back, and we're going to strengthen the transverse abdominis muscle. That's our core muscle. We're going to do a couple things all together. You're going to love it. I'm going to run through it exactly the way you're going to need to do it at home, and we're going to do it together right now. So, the first thing we want to do now, you're going to stand from your side, stand up nice and tall. And what I want you to do is I want you to take your hands and put it on your buttocks, okay? Now remember, the pelvic goes forward with tight hip flexors. So when you put your hands in your buttocks, put it down a little bit low, close to where you're sitting on when you sit down, a little higher up. And when you push in, right about in here, you're going to push in and down. Now watch what I'm doing. When I push in and down, look what I'm doing. I'm rocking the pelvic backwards. See what I'm doing here? Push in and push down. So you rock the pelvic backwards. So let's do it together. Put your hands on your buttocks. Stand up straight. Try not to extend your back. Okay? We just want to use our arms now. So we want to use our arms and push in and down. Go ahead. Now feel that stretch. You should feel it in the groin and you're going to feel it in your lower back, deep inside. You don't have to push too hard, but get in there nice and firmly and just hold that for a second. You're going to say, wow, I never knew that those muscles are so tight. Relax. Grab it again. Push in and down. Go ahead and push it forward as you're pushing your groin forward. Try to keep the back straight. You're going to feel stretching all in that lower back, deep inside, way deep. And you're going to feel stretching in the front, different areas depending upon how tight you are in there, and just hold that position like that. So at first, I'm going to want you to continue doing this for about 5 times. Push in and down, and you're going to hold it about 7, 8, 9 seconds, give or take. And we'll do that 5 times. This is number 3. And feel that stretch. Try to stand up tall. Try not to extend your back. Relax. You're going to say, wow, this is going to help heal you because When you have low back problems, the majority of it is coming from muscular imbalances. And so we're going to stretch these muscles, release them, strengthen the core, which we're going to do next. This is how we're going to heal these conditions. Push in, last one, push in and down. Wow. Try to stand up tall. Just feel your pelvic pushing forward, your pubic area pushing forward. You're going to feel all that beautiful stretch. You never knew how tight you really are. Now, I want us to do the same thing again. This time we're going to push in and down, hold it in that position. And now what I want you to do is bring your belly button in towards your spine, pull it in. Wow. You're going to hold that 5 seconds. Feel those muscles contract. That's your transverse abdominis. Relax. Pull back the belly button again, keeping pressure on the buttocks, pushing in and down and forward. Oh my goodness, bring that belly button back. Good, that's 2. I'm gonna do 5 with you. You're gonna continue doing these after. Let's go push forward and down. Squeeze that belly button. Wow. 3, relax the belly button. Push again, forward. Pull that belly button back. Pull it back. Wow. You feel that? It burns. I know it hurts. I'm sweating too. Last one, push in and down. Pull that belly button back towards the spine. You feel those muscles? Okay. You're going to shoot for 10 to 12 because you can do this on your own. You're on your own now. But I wanted you to get that feeling of what it's like. And you're saying, my goodness, but wait a second. What you just did is you're strengthening the transverse abdominis muscle. That's the muscle that straps all in the deep abdominal area. That supports the organs, the pelvic floor. That's what allows you to sit up straight, sit tall. It prevents back problems. This will strengthen your whole lower pelvic area. This will help you stand up taller. It will help you sit easier. It will help you get up easier. You're going to feel much better. And I will promise you one thing. If you do this particular exercise with those core exercises, pulling that abdominal, that belly button back, and try to shoot for a couple sets of 10 and do those every day, you're going to see within a week huge changes. And if you're a low back sufferer, if you have herniated discs, bulging discs, osteoarthritis, this is so safe for you. This is so good because you're strengthening your core. You're taking the abdominal area and you're pulling it back. And those muscles are strengthening your core. It's kind of like me giving you a core set and saying, okay, put the core set on. You feel how good that feels? You don't need a core set. Strengthen the muscles. Because everything that you do from here on in, from brushing your teeth to leaning over to getting in your car, to sitting down to getting up, the twisting, the cleaning, the playing sports, doing hobbies, whatever it is, you need those core muscles because when those core muscles are weak, that's when you put the load on the disc, you put the load on the ligaments. That's how you develop low back problems. And there's millions of people out there, and I'm sure you can speak if you are one, what it's like to have a low back problem because that can cause sciatica, burning, radiculopathy, neuropathy, difficulty sleeping, emotional problems, sexual problems. The list goes on. Please, if you look at the things that you do every day, sitting down, tight hip flexors, weak glutes, do these exercises as I just showed you, getting up, sitting down, build the glutes, stretch the hip flexors, working the transverse abdominis, the deep core muscle, which is the most important stabilizer in the pelvis, you're going to feel so much better. So lots of sitting like this contracts our hip flexors, cause them to become contracted, shutting off the opposite muscle, which is our glutes. Our glutes are not firing the way it should. You may notice when you're walking around, you feel weakness because the glutes are being shut off. But one of the greatest exercises that you can do at home is just getting up from a seated position. You can use your arms if you have to. When you get up, squeeze the glutes when you get up. Squeeze them together. Squeeze your cheeks. Sit back down. Getting up, squeeze the glutes. Sit back down. When you get up, squeeze the glutes. Make them nice and tight and go back down. You're going to do 12 repetitions of those. You're going to build up to a couple sets. If you have a hard time getting started, do the best you can. Over time, your glutes will get stronger, and that's going to help your back problems go away and prevent you from having back problems as well. Please share this with your friends and family. You'll be doing them a huge favor. And do me a favor. Please start eating healthy. Get rid of the processed, refined sugars. Eat your fruits and vegetables. Get your soluble fiber. Wow, it's so important. Your chia seeds, your flax seeds, your pectin from your fruits. That soluble fiber is such a beautiful thing to keep your body strong, to keep your blood sugar level, to give you your energy, to help you sleep right. Get a little exercise. If you got to meditate, do some deep breathing exercises, drink your water. Just change your life right now. Don't wait for tomorrow. Do it today. You'll make me happy. You'll make yourself happy and your family as well as your loved ones. I hope that this video serves you well. Leave your comments below, please. I would love to see how you do in the near future. And most important, make it a great day. I'm Dr. Alan Mandell.